welcome to the special town hall part of the NDTV Detol Banega Swasth India campaign. Today, we are saluting the COVID heroes. I'm Ambika Singh Kama.
और मैं हूं संकेत उपाध्याय। कोविड-19 की दूसरी लहर तबाही लेकर के आई। लोगों की तकलीफ, उनका संघर्ष जितना दिखा उससे कहीं ज्यादा अनसुना और अनदेखा रहा। लेकिन ऑक्सीजन की कमी, दवाई की कमी, बेड की कमी के बीच से ही उम्मीद की किरण जगी। कुछ ऐसे अनदेखे अनजाने लोग जो इस त्रासदी में और इस त्रासदी के चलते अपने बन गए, जिन्होंने कोरोना की जंग में एक अहम भूमिका निभाई।
They helped unite India in grief and pain, but with an overwhelming desire to help each other through the toughest of times. We have seen how our country has come together to fight the virus. Exemplary work is being done by organizations, corporates and individuals in these difficult times, and a new breed of heroes with an invincible spirit and deep compassion and empathy have rushed forward to help fellow citizens.
आइए इन्हीं हीरोज को सराहें, सल्यूट करें, जिनके निस्वार्थ प्रयास से हम स्वच्छ, स्वस्थ और सुरक्षित हुए। मैं स्वागत करना चाहता हूं हमारे अपने एनडीटीवी के चेयरमैन डॉक्टर प्रणॉय रॉय का, जिनकी अगुवाई में ये मुहिम जारी है और पिछले 7 साल से लगातार हमारे साथ भारत को स्वस्थ और स्वच्छ कराने की इस मुहिम में कैंपेन एम्बेसडर की भूमिका निभाते हुए सदी के महानायक श्री अमिताभ बच्चन। डॉक्टर रॉय, इट्स ओवर टू यू।
Well, Ambika and Sanket, as you've been just saying, we've all been through a really, really excruciating period, both physically and mentally and unfortunately, deeply emotionally. Each one of us have lost so many members of our families and our friends. Everyone has been to hell and back, but we are back. And one thing I've noticed throughout this crisis, I've not heard one person complain about the doctors, the nurses, and the ward staff. They have been just wonderful, working night and day, taking risks, many of them getting COVID, but coming back within a couple of weeks, just to keep our spirits high, even though they are exhausted. We're really, really lucky, Ambika and Sanket, for once again to have Amitabh Bachchan with us. Amitabh, thank you. Thank you for joining us. You're looking good. You had COVID, and I think you had you were in hospital for quite a long time, and you did mention that the hospital staff and the doctors, nurses, everybody was fantastic, and not just to you, to everybody, right?
This period has been very trying for all of us, and not just within our country, but all over the world. We haven't been able to find any kind of a positive solution to it. But the fact that, as you mentioned, the people that have been continuously fighting this war are just unbelievable. Their spirit, their dedication, and their selflessness. As you said, I was in hospital, and you cannot believe the kind of effort they all make to make you comfortable, to make you well. And they don't go home 24 hours, round the clock. They are there in their suits, in their attire, attending to you, the ward boys, the nurses, the staff, just incredible atmosphere. And what a spirit. And every day, not just coming and doing their work and medically, but coming and encouraging you, giving you hope and say, don't worry, everything is fine. Even though they know the blood reports, they know the reports every day, and they know things are going wrong somewhere, they will never say that to you. All they will say is, your reports are looking good, we are well, we are good. And somehow you just feel nice about it.
Right.
And that's what they've been doing, and really creditable. So, Sanket and Amitabh ji, this is superb. Absolutely. What a wonderful thought by NDTV to honor these people who really have been the backbone during this crisis.
Really, we should all just close our eyes for a couple of seconds and just thank each and every one of our medical staff. God bless them all. God bless them.
The second wave of the COVID-19 pandemic has been challenging for everyone. Thousands scramble for oxygen, hospital beds, and even crematorium spots. But as a nation, we also witnessed how people realized that the need of the hour is for humanity to come together and look out for each other and selflessly help those who need it the most. India's COVID-19 heroes, real everyday heroes who despite these difficult times came forward to help. Today, let's salute these extraordinary people who have emerged as saviors, helping and saving thousands. We salute their courage and compassion.
There's a sign here that says, "Imagine a world without COVID." I do want to imagine one.
The COVID-19 pandemic's second wave has brought so much pain and suffering. But during these unprecedented times, we've also been witness to acts of kindness, selflessness and bravery as people have gone beyond the call of duty to do their bit to help humanity. The ongoing wave of COVID-19 saw thousands of citizens offer help and organize into volunteer groups as the country faced an acute shortage of medical oxygen, medicine supplies, hospital beds, and other essential healthcare services. SOS calls and messages flooded social media platforms, prompting regular citizens to step in and help one another. We've seen how our country has come together to fight the virus. Exemplary work is being done by organizations, corporates, and individuals in this difficult time. A new breed of heroes with an invincible spirit have stood up to help fellow citizens. Some people are going out of their way to provide oxygen facilities, pack food, services, and ensuring that people are not fighting these battles alone. We salute these Corona warriors, those heroes who are leading by example and helping making this world a safer, better place.
That's the point. They were leading by example. They didn't have to do this, but they thought of doing this. I would like to welcome Mr. Lakshman Narasimhan, the CEO of Reckitt, as well as Gaurav Jain, Senior Vice President, South Asia, Reckitt, to ask questions of them. Dr. Roy, it's over to you.
No, I just wanted to thank both of you for joining us and for all the work you've been doing this year and all these years for society. Just tell us some of the initiatives you've taken this time.
Well, firstly, it's an honor to be here and to partner with NDTV and with Mr. Bachchan and all of you to salute these remarkable heroes. I mean, we're a very small player in all of this, but our heart has gone out as we've seen the front line in action, the doctors, the nurses, the medical staff, but also just the remarkable number of people in the community who stood up to be counted. And so our heart goes out to all of them, you know, given what they have done. They have in a lot of ways stitched India together in so many wonderful ways. You know, at these moments in time, it becomes quite existential. You ask yourself the question, why you as a company exist? And, you know, we did, and we said we existed to protect, heal, and nurture in the relentless pursuit of a cleaner and healthier world. And this protect piece became a very big deal for us, both in terms of products and product availability, but also importantly, just given, you know, what we do, we have the ability with what we spend, what we do with our brands, to ensure that information gets out to people. There's normally 1 or 2 or 3 things that people can do to protect themselves. And we have actually put a lot of money behind that, including partnerships with governments around the world in order to make that happen. You know, at this point in time, it made complete sense for us to say we would take, you know, about 1.5% of our operating profit and give it away. And we've done that through a variety of things, which I can touch on over. But also importantly in India, you know, we've spent time focused on our people ensuring that they're safe in the factories, that the communities in which we live and work are safe, you know, vaccination drives, oxygen, all of that. But also, you know, spread the word. But at the end of the day, you know, what we have done and what we've tried to do is recognize that our place is small, that even a brand as powerful as Dettol needs to stand back and salute all these wonderful heroes. And that's what we've been trying to do in the last while.
You played a very important role. And very importantly, Sardar Gaurav Jain. He's a Sardar at heart.
Thanks.
And
Thanks for having us.
You've done a lot, but just tell us this idea that you had of Dettol salutes. What exactly was that and how did it work out?
No, first of all, thanks for having us, and it's an honor to be here with you and Mr. Bachchan after a long time, I think. As you remember, Dr. Roy, last year, I think the role of the brand we felt was education. And obviously, that was the right thing to do with hand washing, wearing a mask, and keeping the social distancing. And that's what the brand tried to do, to educate as many people as possible. Through various campaigns that we did, and I think we spoke about one of the big ones that was very successful was the TikTok campaign, which we actually reached about 120 billion views, which became very big, and it helped to educate a lot of people about hand washing, which I think was a good thing. I think this year when the second wave came and we knew obviously it'll end someday, I think the role of the brand was to evolve to become much more than education, because obviously people had been educated about the need for hand wash and masks and things like that. And I think we took on the role of being this harbinger of hope and cheer in this gloom and doom that, as you said, existed. And I think the role of brands, and especially a brand like Dettol, which is perhaps one of the most trusted brands in India, it has to be to enhance people's lives, not only by protecting them from germs and illness, but also to spread happiness and cheer. So I think the first thing that we did was to have that campaign, the anthem, which I think NDTV has run. It's running very successfully. It's an anthem of hope, of winning against COVID, and it's sung by children, and it's beautifully penned by Mr. Prasun Joshi and his team. So that was the first thing we did, but we felt we needed something which was deeper, which involved people. So my digital team actually came up with this idea of getting these heroes, and if we can, honor. If I know somebody who's done well, I can actually go on a website and say that Mr. X, did a great job. So I will nominate that person, and we send them a virtual pack of Dettol with the photo of that person. So not only have we done that virtual pack idea, and we've already had 200,000 odd people nominating people for getting a virtual pack on the social media, but we have basically taken 100 fantastic stories from all over India and put them on our pack, on our real physical Dettol liquid soap pack, which is rolling out right now.
जी, ये एक स्वर्णिम पहल थी डेटॉल की तरफ से. मैंने देखा किस तरीके से वो पैक के ऊपर लोगों की तस्वीर लग रही थी, उससे बड़ा उत्साह भी लोगों में आया.
Joining us now is Dr. Randeep Guleria, Director AIMS. Thank you so much, Dr. Guleria, for joining us. India's medical fraternity is so bravely fighting this battle against COVID, often at a great personal cost. When hospitals are overwhelmed and the system is overwhelmed, what does it mean to you as doctors to see the way humanity has responded to help each other during this pain and suffering?
The last 1.5 years has seen a lot of pain and suffering. It's been a time of sorrow also, and many of us in the community have lost someone near and dear to us. For the health care workers, it's been a tough time. We've been working day in and day out, trying to really help people and really realizing that medicine is both a science and an art. So the art of medicine in terms of empathy towards your patient, in terms of caring, becomes more and more important during a time like this. But what has also really been very heartening for healthcare workers is the resilience that Indian citizens have shown. They've all come together, no matter what be your background, whatever little bit one can do, they've all come together and really try to help as far as this pandemic is concerned. Whether it's supporting people in terms of providing food, whether it's medicines, whether it's oxygen, or whether it's doing simple things like getting masks available for people, or going to the extent of making PPEs, making ventilators. I think from industry to the common man, everyone came together, and I think this really showed the true strength of our country in terms of fighting the pandemic.
You've also, Dr. Guleria, recently said that we need to focus on the lessons that we may have learned in the past and the possible third wave. I keep insisting on that, but I just feel that if there is the possibility of this third wave, what, according to you, are the biggest lessons that we need to learn?
So I think there is a lot of learning that we've had over the last 1.5 years. Some of it is, of course, for the medical community in terms of treating patients and how best to provide care. But the biggest lesson that we've learned, I think, is between the first and the second wave. And that is what will really help us to prevent subsequent waves. What can we do right, which we didn't do right in the past? And I think 2 or 3 things. One, of course, is the importance of COVID-appropriate behavior. Because no matter what be the variants that emerge, no matter what be the new mutants that we see, if we are able to maintain physical distance, if we are able to wear our masks properly, and if we are able to wash our hands and prevent crowds from forming and therefore not have super spreading events, then we will not allow the virus to spread. This is a virus which is human to human transmission. One person gives it to the other. There's no other way that it can spread. If we understand the importance of this and really follow COVID appropriate behavior, come forward and get vaccinated, so that the more the people who are the more the number that get vaccinated, the less the chance of transmission, the less the chance of viral replication, and the less the chance of mutants developing, we will actually be able to come out of this pandemic. We will be able to have a very minimal or delayed third wave, and this is what we need to do.
One of the things I think, following on again from Amitabh Bachchan, is that in a third wave, say it happens, whatever, November, December, January, God knows when, and God forbid it happens at all. But we want our children to go back to school. But we keep talking about vaccines only for 18 plus. Shouldn't we think about our children? I mean, they are our goalkeepers, they are our future. It's like going into a cricket match without a wicketkeeper, without a football match without a goalkeeper, if we don't look after our children. So shouldn't we really look forward and start considering vaccination of people under 18 as well?
So I totally agree with you. I think physical schools is very, very important for children and for college-going students also. And there's been a lot of this which has been sort of not been there. And when we talk of schools and colleges, it's not only about education, it's about character building. It's about getting people to have socialized, to really become good individuals, good citizens of the country. And therefore, physical schools are important. Also, it really marginalizes those who don't have access to the internet or not tech savvy. And therefore, that marginalized population has not had any education for the last 1.5 years. Therefore, opening schools is very important. But the other important thing is to do it in a manner that we don't allow the infection to spread and are able to protect children. I think to do that, vaccination is the strategy. Along with that, we will have to develop other measures. The Pfizer vaccine already has been approved for children. The Zydus vaccine, the Zydus Cadila vaccine, which is made in India, which is a DNA vaccine, also has been tried in children, as has been shown to be safe. And the Bharat Biotech vaccine is also undergoing trials, and hopefully by September, the approval for that should also come. The other important thing that I'd like to mention is, because this issue has always come up, that the third wave is going to affect a lot of children. I don't think that is true for 2 or 3 reasons. The previous waves and the ongoing pandemic has not caused a severe infection as far as children are concerned. Secondly, data that we looked at, a serosurveillance that we did at a sentinel surveillance, showed that a large number of children, more than 50% of children who were tested both in urban and rural area, already had antibodies. So they had got the infection, which was mild, and they had already been protected. Research will evolve, and we will have new research coming up. But the important thing is to remember that the virus is also evolving. So we have to be careful when we look at both how the virus evolves and what the research comes up, and whether that research is up to date with the way the virus is behaving today. Because what research we have may be a few months old, but that may not be relevant today, as we've seen with the older variant and the Delta variant. The Delta variant was much more infectious and caused this huge spike that we saw in the second wave, unlike the first wave, which was with the original Wuhan strain. So there is a sort of a time lag which we have to be cognizant of,
that is
and
a
therefore
big worry.
vaccine is something that we need to push aggressively in children.
Thank you so much, Dr. Guleria, for joining us today. Over to you, Mr. Bachchan.
All right. This is to Lakshman Narasimhaji, the impact of the second wave vaccinations, the medical infrastructure. Where do you feel are the gaps that Reckitt can help governments around the world, including India, in plugging all these points?
I think it's a very interesting strain of conversation we've just been through. I think that the one thing that's clear is vaccinations are hugely important. It's very important as well to really shore up the medical infrastructure. This is going to take time. In the time when that is happening, as we prepare for the third wave, it's crucial to get ready. Now, one of the things that we've realized is in this sort of intermediate phase, there's a lot of information that is very confusing. And it's not just about the vaccine, which is effective, which is not, which antiviral is correct, not correct. It's also in some of the practices. And what I've seen around the world is there's been a sort of a bit of a political spin on some of these activities. What actions you take, don't take. There's been a spin. This is not correct. That is not correct. It plays into freedom. All of those, very difficult questions. One of the things we did, therefore, and this is a real gap in public health, is we realized that we need to put some money behind actually coming up with some of those answers. And we set aside about $25 million in partnership with Yale, with Harvard, with Cambridge University here, the London School of Hygiene and Tropical Medicine. Dr. Golleri has been very involved as well with AIIMS, with Tsinghua in China, but also National University of Singapore. And what we've done is we've actually established a bunch of postdoctoral fellowships in every one of these schools, and even more in Africa and others, in order to do research around how do you ensure we get ready around the science of behaviors and we understand what works and doesn't work. So they can actually be, it's not opinion, it's fact. So research that's going on. The second thing we are doing is, I think the point around schools is a very good one. And I think, as you know, for the last many years, we've been recognizing that building these clean habits in children is very important. Today, we stare at the fact that, 20% of people wash their hands after going to the bathroom worldwide. Now, during the pandemic, the sensitivity of this went up. In some countries, over 86% said we've adopted clean behaviors. But it's very important to instill this in children. So if you take India, we are now in 1 million schools in India teaching clean behaviors. So when kids go back to school, there is curriculum, there's practices, there's things that we have that will actually help them behave differently. It's also true that in the US, one of the things you find in these schools is you actually have people falling out. So in the poor parts of the US, where we have a big brand called Lysol, we're working with schools in underprivileged communities, over 200,000 schools, around behaviors and practices. So schools are a very important place. And the third one is back to the point I made earlier about consumer behavior. I think the point Dr. Golleri made is absolutely correct, which is in this period, there are behaviors we simply must have in our toolkit, and we must behave so. In order to do that, our brands play a role. And we are moving a lot of our money, so to speak, in what we spend to reinforce these messages in partnership with a lot of public health organizations and parts of government that do that. So it's about the Reckitt Global Hygiene Institute, where we put money aside. It's about education, particularly in schools, and it's about consumer behavior and using our brands. Those are areas that we have taken on as things that we can do to partner with governments, recognizing fully vaccination and medical infrastructure become very important.
Today, as we grapple against the COVID-19 pandemic, it is even more important to make the connection between health, climate, and the environment. We humans have transformed the majority of the world's ecosystems, destroying, degrading and fragmenting terrestrial, marine and other aquatic habitats and undermining the services they provide. Enhancing environmental health through better air quality, water and sanitation, waste management, along with efforts to safeguard biodiversity will probably reduce the vulnerability of communities to pandemics and thus improve overall societal well-being and resilience.
Today's COVID-19 global crisis is a stark reminder of the complex links between the transmission of infectious diseases and biodiversity. Biodiversity loss is associated with the transmission of a range of pathogens, while land conversion and wildlife trade bring more people into contact with potentially new diseases.
We're hearing this term, zoonotic diseases. A zoonotic disease is an animal infection that's transmissible to humans that causes the disease in the humans. Could be a virus, could be a bacterium, could be a fungus or some other kind of an infectious agent. Whatever it is, when it passes from its non-human host into its first human, that event is called spillover, which is why my book is titled Spillover. If it spreads through a dozen or 2 dozen humans, we call that an outbreak. Maybe the outbreak can be controlled. If it's not controlled, if the virus or whatever is very transmissible and it spreads through a whole country, you've got an epidemic. If it makes it to an airport and spreads around the world, we have a pandemic, which is what we have now. All of these zoonotic diseases account for 60% of human infectious diseases. So this is not some obscure thing off at the fringe of medicine. This is central to human public health.
Scientists estimate that zoonotic diseases account for 3/4 of new or emerging diseases in humans. Many deadly pathogens in recent memory, Ebola, HIV, dengue, SARS, MERS, Zika, West Nile, have taken this interspecies leap.
At the end of the day, human and animal and environment.
This interspecies leap.
At the end of the day, human and animal and environmental health are one and the same. And that must be the learning that we take away from this terrible pandemic of COVID-19 and the tragic suffering that we're seeing around the world, including in India, of course. As we degrade the natural world, we're chipping away at the very foundations of what makes well-being possible. That means our food, our water, the temperature regulations, economic growth, the roofs over our heads, the clothes we wear, all of that is provided by nature. So the pandemic has shown us that we really need to rethink our relationship with nature.
It is clear that overexploitation of habitats and wildlife trade can play an important role in disease propagation, and it is important to recognize how important it is to protect the ecosystem, to protect ourselves.
All right, Mr. Narasimhan, you have, I believe, a very significant partnership that is already underway, and that is for COP26, the UN Climate Change Conference in Glasgow this November. Reckitt will be the hygiene partner for this summit. What are you looking forward to achieving through your role in this summit?
COP26 is a massively important event, and it must happen because there's a bunch of governments, bodies, institutions coming together in order to debate the future as to how we attack climate change more broadly globally. And we were fortunate, I think it's the history. I mean, we've been in India with Dettol for 80 years, over 90 years over here in the UK. And so the UK government has picked us in order to ensure that there are protocols established so that the conference can happen in a safe manner. But that to me, I think, is the sort of near-in piece to it. The second piece is what Ambika just mentioned. Our objective there is really to make this connection between biodiversity and health. The more we harm the environment, the sicker we are going to get. And we've talked earlier about the fact that insects live much longer. 1 degree Celsius increase in temperature means insects live 6 times longer, and the bite is harder and deeper. And so we have to get this right. And we're working in various parts of the world on a whole bunch of decarbonization efforts, including inside our own company. But it's important at COP26 to reinforce this message of biodiversity and health. We simply must take care of the climate, because if we don't, it's going to make us sicker.
Thank you, Mr. Narasimhan. We will have you back on the show, of course, but for the moment, thanks so much for joining us. It's time now to meet some of our COVID warriors whose compassion and generosity has meant the difference between life and death for lakhs of Indians. हमारे साथ दिल्ली का एम्बुलेंस जोड़ा हिमांशु और ट्विंकल कालिया हैं।
ट्विंकल और हिमांशु जी, आपको दिल्ली का एम्बुलेंस जोड़ा कहा जाता है। आपकी एम्बुलेंस गंभीर रूप से बीमार लोगों को अस्पताल और शवों को शमशान ले जाती रही है। आप खुद कैंसर को मात दे चुके हैं, तो अपनी हालत भूलकर दूसरों को मदद आप कैसे कर पाए?
ट्विंकल को जैसे डायग्नोस हुआ ब्रेस्ट कैंसर और उसका ट्रीटमेंट चल रहा था, पहले ऑपरेशन हुआ, फिर कीमो हुई, फिर रेडिएशन हुआ। डॉक्टर ने सख्त हिदायत दी थी कि आपको ज़्यादा से ज़्यादा रेस्ट की ज़रूरत है, क्योंकि वेन्स बहुत वीक हो गई। लेकिन जिस तरीके से एमरजेंसी केसेस आए, कहीं भाग दौड़ बहुत बढ़ गई लोगों की, भागम भाग अस्पताल की तरफ, ऑक्सीजन की कमी, ऊपर यहाँ तक कई जगह से तो ऐसे फ़ोन आए कि 2 दिन हो गए हैं डेड बॉडी को घर में पड़े हुए, लेकिन उसे कोई उठाने वाला नहीं है। उस दर्द के आगे ना मतलब हमारी ये कोशिश थी कि हम मरहम रख पाएँ। सबसे बड़ा जो सुकून मिलता है, जो शांति मिलती है, वो ये मिलती है कि हम कई लोगों का जीवन बचाने में कामयाब हो पाए। डॉक्टर्स की हिदायत के बावजूद अगर ड्राइवर गया है तो मैं जा रहा हूँ एम्बुलेंस लेके, इवन मैं नहीं हूँ और फिर कोई इमरजेंसी केस आया या किसी डेड बॉडी को उठाने का केस आया तो ट्विंकल खुद बेड से उठ के एम्बुलेंस ड्राइव करके लोगों को हॉस्पिटल तक भी पहुँचाने में उसने संभव प्रयास किया और शवों का अंतिम संस्कार कराने में भी उसने अपनी पूरी ताकत लगा दी। और जब मैंने उससे पूछा कि तुम खाना बनाने के लिए तो उठ नहीं पा रही थी, तो तुम ये केसेस कैसे कर लेती हो, तो उसने कहा कि पता नहीं उस समय ये एनर्जी कहाँ से आ जाती है और वो ताकत कहाँ से आ जाती है।
ट्विंकल जी, मैं आपसे सवाल पूछना चाहता हूँ। आपने परेशान लोगों को मुफ्त में एम्बुलेंस सेवा दी, जिसका अभी जिक्र भी कर रहे थे आप, जब दूसरी लहर अपने चरम पर थी, लेकिन आपकी ये एम्बुलेंस सेवा दरअसल कई साल से चल रही है। इसकी शुरुआत कैसे हुई?
उनकी एज 14 ईयर्स थी जब पापा जी का रोड एक्सीडेंट हुआ, तो इन लोगों ने 6 से 7 हॉस्पिटल चेंज किए, बट कहीं भी इन लोगों को एम्बुलेंस नहीं मिल पाई। तो उस समय इन्होंने ये प्रण लिया था कि अगर भगवान मेरे को इस लायक बनाए तो ये सेवा जो आज ये परेशानी मैं देख पा रहा हूँ किसी और बच्चे को नहीं देखने दूंगा या किसी और फैमिली को नहीं देखने दूंगा। जब ये चीज़ें मुझे पता चली तो देन मुझे भी बहुत प्राउड फील हुआ और 2002 में हमारी शादी हुई। शादी के मंडप में भी एम्बुलेंस सजी खड़ी थी। तो अब हम ऐसे ही करते हैं, EMIs पे एम्बुलेंस लेते हैं, देन फिर उसके बाद दूसरी एम्बुलेंस ले लेते हैं। कोविड के चलते भी 200 से ज़्यादा केसेस आ रहे थे, कॉल्स आ रही थी और 24 में से 22 घंटे हम लोग, जो हमारी टीम है, जो हमारे ड्राइवर्स हैं, हम लोग हैं, सब सेवा में लगे हुए थे। ना कुछ दिन ना रात कुछ नहीं देख रहे थे।
अंकल जी, मैं अमिताभ बच्चन बोल रहा हूँ और आपकी बातें सुनकर और आपके पतिदेव की बातें सुनकर ये कहना हमारे पास शब्द नहीं कि किस तरह आपको बधाई दें, आपकी तारीफ करें। ये समाज सेवा जो आपने की है ये अद्भुत रही है और आप एक इतना सुंदर उदाहरण आप बन गई हैं देशवासियों के लिए कि मैं उसका बयान नहीं कर सकता हूँ। बहुत बहुत बधाई आपको। आपको क्या एक पूछना चाहूँगा सवाल, क्या महिला एम्बुलेंस चालक के तौर पर कभी भी आपको कोई मुश्किल आई या दिक्कत पड़ी?
सर, मेरा तो मानना ये है कि जैसे अपनी फैमिली में अगर किसी को कुछ प्रॉब्लम हो तो क्या हम उसको कैसे फर्स्ट एड देंगे। तो जब किसी के साथ कोई प्रॉब्लम्स होती है ना, तो मैं भूल जाती हूँ कि मैं महिला हूँ या कुछ ऐसे है, तो मेरी प्रायोरिटी रहती है उसको फर्स्ट एड देना, उसको जल्दी से जल्दी हॉस्पिटल पहुँचाना और मुझे कुछ याद नहीं रहता। और दिक्कत जो आती है, बट बच्चे मेरी 2 बेटियाँ हैं और छोटी हैं, बस ये है फैमिली का सपोर्ट है, मेरे हस्बैंड का मुझे बहुत सपोर्ट है। अगर सभी को इस तरीके से सपोर्ट मिले तो हर महिला कामयाब बन सकती है। कुछ टाइम पहले अभी एक केस हुआ था, मैं एक्चुअली एम्बुलेंस से किसी पेशेंट को छोड़ के आ रही थी, तो कुछ लोग रोड से भागते हुए जा रहे थे काफ़ी दूरी तक, एक बच्चे को गोदी में लेके, उनको एम्बुलेंस नहीं मिल रही थी। तो रेड लाइट पे ट्रैफिक में, दिल्ली का ट्रैफिक तो आपको मालूम ही है कैसा होता है, तो एम्बुलेंस खड़ी थी, तो लोग आए मेरे पास, उन्होंने पहले तो एम्बुलेंस देखी, फिर मेरी तरफ देखा, अरे मैम आप एम्बुलेंस चला रही हैं, प्लीज़ एक बच्चे को हॉस्पिटल तक छोड़ देंगी। मैंने कहा हाँ आप ले आइए, कोई इशू नहीं है, मैं छोड़ दूँगी। जब वो लेके आए तो 7 साल का बच्चा गोदी में बहुत कर्रा रहा था अपने मामा की गोदी में, और उसकी मदर थी साथ में, उन्होंने टॉवल में उसकी लेग को पकड़ा हुआ था, टांग को, और बहुत ज़्यादा खून बह चुका था। उस बच्चे को 3 मिनट और 52 सेकंड में हिंदू राव हॉस्पिटल, मैंने इंदरलोक से हिंदू राव हॉस्पिटल पहुंचाया। तो जब मैं गई वहाँ हॉस्पिटल में और जब सब थोड़ा ठीक हो गया, बच्चा हॉस्पिटल पहुंच गया, तो डॉक्टर्स ने मुझे कहा कि मैम आप इसको बहुत जल्दी ले आए, वरना इसकी लाइफ बिल्कुल नहीं बच सकती थी, क्योंकि ट्रेन एक्सीडेंट से उसकी लेग कट गई थी और आधे घंटे से वो बच्चा वहीं पे तड़फ रहा था और उसकी किसी ने हेल्प नहीं की थी। तो ये तो जब मैं उस बच्चे से 6 महीने बाद मिलने गई तो वो बच्चा एक टांगला कि बेटा असली अम्मी और अब्बू तो ये है, इन्होंने तेरी ज़िंदगी बचाई है, हमने तो सिर्फ तेरे को जन्म दिया है। तो ये मेरे लिए जो बात थी ना उनकी, वो अवार्ड से भी बड़ी थी। और यही चीज़ें होती हैं जो मेरे दिल को छू जाती हैं और मोटिवेट होके आगे बढ़ के मैं फिर से लग जाती हूँ सेवा में।
क्या बात है, क्या बात है टिप्पी जी, बहुत बहुत बधाई और शुभकामनाएं हम सब की तरफ से।
थैंक यू सर, थैंक यू सो मच।
All right, moving on now to our next COVID hero, Dattatreya Sawant. He's an English teacher and also an auto rickshaw driver. Mr. Sawant, thank you so much. You run an auto rickshaw ambulance service. आप मुफ्त में been able to earn from your teaching job because of schools being closed. ये आपने कैसे सोचा कि ये सेवा शुरू की जाए?
जब मैं हमारे महाराष्ट्र में यानी पूरे लॉकडाउन शुरू हो गया 15 अप्रैल से, तब मैंने सोचा कि मुंबई की हालत बहुत ख़राब थी, सब जगह बहुत कंडीशन बिगड़ थी। इसलिए मैंने सोचा कि मेरा ऑफलाइन ऑनलाइन बंद है, अभी क्या करूं कि रिक्शा में धंधा भी नहीं है। लेकिन मैं अभी सामने जो कंडीशन देख रहा था बहुत दिक्कत थी, लोगों को अस्पताल जाने के लिए बहुत दिक्कत हो रही थी, समय पे एम्बुलेंस नहीं मिलती थी, कौन सी भी प्राइवेट गाड़ी वाला जाता था, एम्बुलेंस वाले आते तो ज़्यादा मुंह मांगे दाम देना पड़ता था। इसलिए मैंने सोचा मैं जिस लंबी एरिया में रहता हूँ उस लंबी एरिया में लोगों के लिए मैंने मेरे ऑटो का इस्तेमाल करना शुरू किया। ऑटो में थोड़ा चेंजेस किया और डे नाइट मैंने सेवा लोगों के लिए देना शुरू किया। ये मेरे लिए बहुत सौभाग्य, क्योंकि मेरी वजह से आज मैं 50 पेशेंट को अस्पताल या से घर या घर से अस्पताल सही समय पे लेके गया। ये मेरे लिए भगवान से भी ज़्यादा बड़ी बात मैं कर सका, ये मेरे लिए बहुत खुशी की बात है।
जी दत्तात्रेय जी नमस्कार, मैं अमिताभ बच्चन बोल रहा हूँ और आपकी बातें सुन करके हम सब बहुत ही आभार एक बार फिर देना समझते हैं कि ये जो आपने सेवा की है अपने मन से, ये समाज के लिए और एक उदाहरण अच्छा बन जाएगा और लोग भी इसी तरह उनका व्यवहार इसी तरह हो। हमने कहीं पढ़ा था दत्तात्रेय जी कि आप थोड़े चिंतित थे, आपके जो विद्यार्थी हैं, स्टूडेंट्स वगैरह हैं, उनके लिए, क्योंकि शिक्षा जो है वो आप स्वयं देते थे उनके सामने बैठ कर के। अब क्योंकि लॉकडाउन हो गया है और इस तरह की व्यवस्था उपलब्ध नहीं है, तो जिसे कहते हैं ना ऑनलाइन लर्निंग, इंटरनेट के द्वारा आप सिखा नहीं पा रहे थे उनको। अब ये फिर से एक ऐसा वातावरण बन गया है जहाँ पर बोल रहे हैं कि एक दूसरा वेव आने वाला है कोविड का। तो अब आपके जितने भी विद्यार्थी हैं, स्टूडेंट्स वगैरह हैं, वो क्या करेंगे अब, और कैसे आप ये अगर विपत्ति मानी जाए तो इसको दूर करेंगे?
देखिए सर, मुझे बहुत खुशी हो रही कि आपके साथ मुझे बोलने का मौका मिला है। मेरे लिए सौभाग्य की बात है कि अभी ऑनलाइन ऑफलाइन ऑनलाइन चालू है, ऑफलाइन बंद हो गया, कि मेरे लिए अभी थोड़ी खुशी की बात है कि ऑनलाइन अभी शुरू हो गया है। लेकिन अभी फ़िलहाल लोग डरते हैं, बच्चे स्कूल में यानी ऑनलाइन के लिए भी स्लम एरिया होती है, इसलिए बच्चों के साथ पास मोबाइल नहीं, इसलिए बच्चों को कांटेक्ट करना पड़ता है, उनके घर में जाना पड़ता है। अभी 2-2, 4-4 बच्चे इकट्ठा करके हमें उनको ये पढ़ाना पड़ता है।
डॉक्टर रॉय,
No, I just wanted to bring back Sardar Gaurav into it, because he's been actually working behind the scenes really hard and contributing a lot. But I just wanted to ask you, Gaurav, you've tried, you have had many ways in which you've saluted and thanked our COVID heroes, some known, some unknown heroes. Just explain how you selected the people, who you chose as unsung heroes.
Yeah, Dr. Roy, I think once we decided that we need to do something to salute them, I think from a brand like Dettol, we need to be sure that we are giving out the right stories, because obviously we don't want anybody who's undeserving to come in, and we are not the experts in finding these stories. So we were very lucky to find a partner in a publication, a digital publication called The Better India. The whole publication I found is basically relying on fantastic stories from across India for very inspiring individuals who've done a lot of change in society. And COVID is one of them that we took, but across topics like education, women's empowerment, children, arts and science, history, travel, you name it, and they have examples and stories of people who've done massive change. And I'm sure they've brought a lot of change to society in the last so many years they've been there. So basically, we went to them, and those people, with their people across India, have curated these stories for us. And they brought these stories after researching them and brought it to our people who have both selected these. And we've basically had a difficult decision, I believe, to make of choosing 100. And that's how we went there.
Gaurav, this is Amitabh again. These are, of course, extremely extraordinary stories that you've been collecting. And what is really honorable is that you're posting them on your packs and not just giving them a lot of importance, but perhaps inspiring many others to come forward and do similar work. What kind of response did you get when people saw their photograph on your products? And is there somewhere where we can read about these people, their stories, including the ones who sort of didn't make it to your bottles?
So Amit, we started the digital activation, as I said earlier. We started it last month, where people can nominate people on, and you get a virtual pack. You don't get the physical pack. But that started a wave of obviously feedback for us. And we have been overwhelmed in the last 1 month with all positive feedback that has come to us. I mean, I've even got letters, physical letters, but a lot of emails and a lot of posts on our social media, Instagram or Facebook sites. So it's all been fantastically positive, and we are very happy and thankful to people for that. And as you said, it's not about these 100 people. It's about spreading the message. It's about spreading that positivity across society, and that is the bigger aim. So on the pack, you have a photo and you have a 4-line message at the bottom of the pack, which shows that, for example, for Twinkle G, I would assume it will say something like, she and her husband give a free ambulance service to COVID patients. So you can see the photo and what they did across packs. So we also have a website called dettolsalutes.com. So a web page called dettolsalutes.com. And all these 100 stories are there.
Yeah, I have a few people on my social media. So if you could send me those stories, I'd be very happy to put it out on my blog, on my Twitter, Facebook.
No,
if that
thanks for that.
We will impress these people and provoke more interaction.
Thank you, Mr. Jain. I would like to now introduce cricketer Jaydev Unadkat, who has played for India and is with Rajasthan Royals. जयदेव जी, आईपीएल के अनाउंसमेंट से पहले ही आपने ये तय कर दिया कि 10% आप जो कमाएंगे, आपकी आमदनी जो है वो स्वास्थ्य व्यवस्था सुधारने में, जो लोग जिनको ज़रूरत है उनको वो जाएगा. ये फैसला आपने क्यों लिया?
It wasn't about कि ये आईपीएल शुरू हुआ या आईपीएल खत्म हुआ तब मैंने डिसाइड किया. टू बी ऑनेस्ट, हम लोग जब से कोविड शुरू हुआ है लास्ट ईयर से, तब से आई थिंक नॉट जस्ट मी बट सब लोग, जो लोग प्रिविलेज थे, सब लोग कुछ ना कुछ हेल्प करते आए हैं. बट लुकिंग एट द सिवियरिटी ऑफ द सिचुएशन, जब आईपीएल स्टार्ट हुई थी और उसके बाद जो 1 महीना था, विच वाज वेरी डिफिकल्ट फॉर अ लॉट ऑफ अस, तो वो सिचुएशन की सिवियरिटी से हम लोग को ऐसा लगा कि वी शुड कम फॉरवर्ड एंड create an awareness amongst at least us who are privileged enough to be here in this position. उनके लिए एक मैसेज दे सके कि यही टाइम है जब हम लोग आगे आके जितनी हो सके उतनी मदद कर सके. तो एक वो चीज थी जो हमारे सबके मन में थी, not just me but my family as well, because it's a decision that is taken in the family, right? So I think that was the motivation that gave us the belief that अगर ये टाइम पे हम लोग नहीं कर पाएंगे तो it doesn't really matter बाकी कितना भी कर सके, बाकी कितना भी बोले.
Unadkat, was it very difficult for you to continue playing away from your family, away from home? You must have been worried about them, seeing what was happening around you. So in this kind of a situation, was it difficult to kind of focus on the game, on the cricket match, and perform to your best abilities?
Was it difficult? I think not really, because when we are out there on the field, nothing else matters. And us as cricketers, we are professional enough to know that we are responsible towards our duty of playing for our teams as well. But having said that, yes, it was stressful at times. I had COVID in my family. My Mamaji suffered from it. He was hospitalized. My wife Rinni's grandmother passed away due to COVID. So she was traveling with me as well in the IPL. So we were away from the family and we were talking on phone to them. We couldn't, come and console anyone as well. So those were the things that I think was happening with everyone, because it wasn't just me. I think a lot of other players were in the same situation in our team. So it was the same in all the teams, and it was a difficult time. Let's not think that we were in a position that not just us but our families were in the bubble. It was just the players who were in the bubble. The families were outside of it, and they were a part of the struggle that the whole country faced at that time. So it was a little stressful at times, but not when we are out there on the field playing.
Thank you, Jaidev, for joining us. And now let's meet our next COVID hero, Dr. Harmandeep Singh Boparai, who returned to his hometown, Amritsar, from New York to help with the growing number of COVID-19 cases. After working as a frontline worker in New York during the first wave, he's now training nurses and doctors regarding the COVID protocol in India. Tell us, Dr. Boparai, what made you decide to place your life in New York City on hold and fly back to India to serve your country?
We've been fighting this war against this invisible enemy for more than a year now. And it's a global war. Whether the front is New York or back here at home in Mumbai or Amritsar, it's the same fight. And with all that we learned, and I learned with my experience fighting in New York, if I were not able to bring it back home to India, to my people at a time of crises, it wouldn't have been worth it. So it was really a no-brainer to come back, since things got so bad here during the second wave.
Harmandeep ji, this is Amitabh Bachchan. As a doctor, you were on the front lines of this war last year in New York. This year, you've been on the front lines in Amritsar and Mumbai. How different have the two experiences been, and are there any lessons from one for the other?
Nice to speak to you, Amitabh ji. The actual day-to-day is vastly different, because we know the healthcare infrastructure is very different in New York versus in many parts of our country. But there are so many similarities. One of the things you quickly learn is that we all here share the same humanity. And when you look in someone's eyes, especially your patient or your colleagues, and see them at their most vulnerable, then you get inspired to see them as you, and you transcend the fear. And that's been one of the great lessons that we've learned across. And it's been one of the great honors of my life to work with people who, in some cases, literally given their lives to help others. And I don't think there's any greater service than that.
That's wonderful to hear. Very, very truthful, very laudable. Thank you so much.
I appreciate it.
एक छोटे से ब्रेक के लिए रुक रहे हैं, लेकिन ये मुहिम जारी रहेगी, तो कहीं जाइएगा नहीं, देखते रहिए NDTV। We are saluting the COVID warriors. Our next COVID hero is Miss Ronita Sharma Krishna Rekhi, who has offered her breast milk for newborns who have lost their mothers to COVID. Among the many appeals for help have been appeals made on behalf of newborn infants who have either lost their mothers or whose mothers are in isolation. And we believe, Ms. Rekhi, you have offered to breastfeed these newborns so that they get the nutrition they need. Ms. Rekhi, how did this start?
Hi, everybody. First of all, thank you very much. So this all started one day when I was, I was just sitting down and going through my Twitter account, and I read about a little baby who lost his mother to COVID, and there was an appeal, I think, from one of his family members that they needed human milk because the baby was a premature baby, and when it's a premature baby, a lot of them don't take formula milk. And when I read that, and I felt, because that time I was in Guwahati, my hometown, I had gone there to deliver my baby, and at that time what happened was that cases were really increasing in Assam, in Guwahati, and I was like, and I thought to myself, maybe there is some child out here who must have lost a mother, or must be in need of breast milk. And that is when I thought that I would also want to contribute, because being a new mother with a new baby at home, I could not go out, I could not do anything. I was feeling helpless, because I remember last lockdown, with whatever little we could, as a society, as a responsible citizen, I went out and did my bit. But this time I was a new mom, and I thought this is the only thing that I can offer. And I said, I just put it out on my social media saying, if there's any baby in Guwahati, if you come across any baby who's in need of human milk, I am there. I will be, I'll be more than willing to breastfeed that baby, or I'll offer them my milk. And this is how this whole thing came up.
Ranita ji, this is Amitabh Bachchan. I just
Namaste, sir.
want to thank you and namaskar, and really want to congratulate you and applaud this very unique gesture on your part of breastfeeding a child who has lost his mother to COVID.
Thank you so much.
This must have been a very difficult decision, not just for you, but for your family as well. Because as you just said, you yourself were feeding your own child, your own infant.
Yes, sir.
Was the family in agreement with what you were doing? And are there certain risks that get involved when you're feeding your own infant?
Sir, I'd like to say something. So, with the moment I read this and I shared it on my social media, my husband came out and he read it and he's like, you wrote this that you are going to offer your breast milk, or you want to nurse a child. Are you sure you want to do this? I said, of course I am. And I just looked at him and I said, are you okay about it? He said, I'm just absolutely okay about this. There is no harm. And for me, the biggest thing is that we say that our children must learn how to share. And when my baby will grow up one day, I will tell her that, the biggest sharing that I could on her behalf was my milk. And my family has been very, very supportive. I lost my father last year when I was 2 months pregnant. And I'm sorry. And I had my brother. So me and my brother and my husband, we were there in Guwahati. And they were very happy and proud about this decision. And then my in-laws were very supportive. Even they were okay about it. And I don't see any risk in it, sir, because as I'm nursing my child, of course, I have to follow a few hygiene. But otherwise, there's no risk, because the way you're feeding your own child, you can feed other baby also. And at that time, I didn't think about the risk. I didn't think about anything. All I thought was, maybe if there's any child out there in need, I can be of some help. That's about it.
That's wonderful to hear this from you, Ranita ji. And I'm sure that the millions of people that are watching this program will be full of praise for what you did. Not just what you did physically, but how mentally you were able to cope with this, and the rest of your family and your in-laws and their support. In today's world, which is fast disintegrating, is wonderful to hear somebody like you saying that how supportive your family is towards what you're doing. Thank you so much. That's really wonderful.
Thank you, sir.
All right. We are also joined in by Dr. Marcus and Dr. Raina. They started Meds for More. This is a facility to collect and redistribute unused medicines. Absolutely unique. I want to welcome you two. Thank you very much for joining us. You started this initiative in May. That's about 2 months ago. And you've already collected. Now, it's very hard to put medicines in this way, but different medicines weighing up to 125 kilograms. And these were unused, unexpired medicines. Now, this is astounding. can you tell us how did Meds for More begin?
Thank you very much for having us. And let me begin by sharing that, yes, it is difficult to quantify, but we're probably approaching the 1 metric ton mark now. It's significantly increased since we last spoke. During the first wave of the pandemic, I was a frontline volunteer working in the slums here in the city that I live in, Mumbai. And I got to see firsthand the challenges that this virus had, both in terms of people's lives on their health, but also the livelihood effect in terms of the cost of medicines and the economics of it. And so during this wave of the pandemic, the second wave, as my wife and I were thinking how we could help people, one afternoon, a member of our domestic staff, he called to say his son had been diagnosed with COVID. And he said, "Can I show you the reports?" I said, "Of course, come." And as we were talking about how we may help, I suddenly realized that in the building that we live, I had 3 patients that I had been treating for COVID, and they'd recently come out of their quarantine. So I put a very simple message on our building group asking anyone with any leftover meds to send it to our home. And if it was okay, then we would make it available. And that's how we saw that if one building could come together to help save one life, then just imagine what a locality could do, what a city could do, or now indeed what the country can do for herself.
Well, that's wonderful to hear. This is Amitabh Bachchan. So this is extremely noble. It's a very noble cause that you and your wife are doing and have done. And what a wonderful example you set for the rest of the world and for the rest of the people within India, is to go out and help people.
Dr. Rana, if I can just ask you, from what I've just heard, there's been a exponential expansion in the amount you've collected and distributed. So are you thinking of going into other areas besides Mumbai and going into rural areas and areas where it's more difficult for them to get medicines?
Absolutely. So our mission has been to collect the medicines from big cities like Mumbai. We are now in 10 other cities across India. We started in Mumbai, but we are now actually active in 10 other cities. And the idea is to collect the medicines from the cities where we have access, where there is affordability amongst people, and then divert these medicines towards rural areas where there is less access and affordability. So the way that we do this is very simple. We have a website whereby someone can log in and they can choose to either donate medicines or become an ambassador to collect medicines for this particular initiative. And from there, once the collection has happened, we have 4 to 5 collection centers in every city that are a part of Meds for More. And from these collection centers, our medicines go to NGO partners who we have tied up with. And from there, they go to either charitable trusts which service slums, or to primary health centers in the rural areas. And then from there on, they reach the people who need them the most.
Dr. Rana, I just want to ask one
That's
thing.
Great.
These medicines that you collect, is there some process that you have which verifies the authenticity of the medicine? And how do you go about it? I mean, you got, kilograms of medicine with you. It must be a very difficult task to be actually looking at them, making sure that they're genuine, making sure that the expiry is not over. This is a management nightmare.
Yeah, sir, absolutely. I never imagined in med school that I would ever be helping set up a platform with reverse logistics and handling something of this type of scale. But what we're really proud of is the fact that, we've achieved this through the great support of so many partners, partners like Uber who help us with transportation. We've got pharmacy partners, we've got clinic partners, we've got NGO partners. So there are literally thousands of individuals who are involved in this entire process with regard to only donating, number one, unexpired medicines, and number two, unused medicines. We're not asking anyone to go out and buy new medicines. That's not the point at all. And in a country like India, where 45% of the healthcare spend out of pocket is the cost of medicine, where every year nearly 50 million people are pushed below the poverty line because they can't afford their healthcare bills. and where over 500 crores of medicines are wasted. This is an economic benefit. This is a health benefit. It's also an environmental benefit.
We urge people not to go out and buy these medicines. That's a very important part of what our initiative stands for, because it's also about reducing waste and then creating the impact.
So we have to send the medicine to the collection center.
That's
or there is a process where they come and collect it from you. No,
we have that as well. So on the website, if you prefer not to send someone from your home or visit, we've got the reverse pickup. We've got a coupon code which our partner provides, giving you a discount, so people can have it picked up from their homes as well.
Thank you so much, Dr. Marcus and Dr. Raina, for joining us today. And now let's see, like, India is expressing its gratitude to these everyday heroes who helped unite India in grief and pain, but with an overwhelming desire to help each other through the toughest of times. Their kindness and bravery is surely an inspiration to each one of us.
मैंने भगवान को सिर्फ पत्थरों में देखा है। आज मैंने इंसान के रूप में भगवान देखा है, हिमांशु जी और ट्विंकल जी। थैंक्स टू देयर सर्विस मैं आज अपनी वाइफ को अग्नि दे पाया, वरना शायद आज वो नहीं हो पाता।
From the banks of Mother Ganga, I am glad to honor and applaud all of our India's COVID heroes. It is through this spirit of selfless service India shows its true strength.
In this situation, they are helping and they are providing these things, and we are happy for that. Thank you so much.
ये जो काम कर रहे हैं, ये ईश्वरीय शक्ति से काम कर रहे हैं।
इतनी मदद ये लोग कर रहे हैं लोगों की, कितने शब्द कहे जाए कम है इन लोगों के लिए।
कोरोना की दूसरी वेव आई और उस दूसरी वेव के अंदर कहीं ना कहीं सभी लोगों ने अपने लोगों को खोया। ऐसे में मैं उन तमाम सब लोगों को सलाम और दुआ करता हूं कि जिन्होंने फ्रंट पे रह के लोगों की मदद करी।
It's scary time when world stood still. Every human, be it rich or poor, had no freedom. Our hearts filled with wishes. Every COVID hero deserves lots and lots of love. Salute to every COVID support.
We are thankful to all the COVID heroes. लिटरली हम लोग तो कुछ ही हीरोज़ को जानते थे जो फिल्मों में काम करते हैं, बट दे आर द एक्चुअल हीरोज़ जो अपनी लाइफ पे खेल के और वो हमें बचाने की कोशिश कर रहे थे।
All right, joining us right now is Dr. V.K. Paul, head of the National COVID-19 Task Force, member of the Niti Aayog Health, and also the chairman of the Board of Governors of Medical Council of India. We also have Dr. Sangeeta Reddy. She's the joint MD of Apollo Hospitals. Dr. Paul, क्योंकि आपकी हिंदी ज़बरदस्त है तो मैं कुछ सवाल हिंदी में पूछना चाहता हूँ। जिस किस्म की स्थिति हमने दूसरी लहर में देखी, उससे क्या कोई बड़ी सीख है जो हम ले सकते हैं? क्या एहतियात जनता बरते या क्या एहतियात और तैयारी सरकार रखे?
ये सारी बातें जो आपने कही, यही बहुत बड़ी सीख है। हमने सेकेंड वेव से ये सीख ली है कि कभी भी अपनी गार्ड हम लोअर नहीं कर सकते। वी कैनॉट लोअर आवर गार्ड। दिस वायरस इज़ वेरी स्मार्ट, वेरी मिस्चीवियस. It comes in waves. Europe is experiencing now an early uprise. Once again, we still have a long way to go. And till such time that we are protected hugely with vaccine coverage of a high order, we have to be even more vigilant. Even beyond that, perhaps there is a journey to be covered. So the biggest lesson of the two waves that India has experienced, and more than that the world has experienced, is do not lower the guard. What does it mean? It means individual behavior above all. If I wear the mask, I am protected. And when I am protected, the virus does not go through me to somebody else. It is my duty as individual to myself, but then it is also my duty to do so for my family member, for my community, for my nation, for my society. That's individual responsibility. Likewise, to maintain social distancing, to avoid crowds, to create situations which spread the virus, because virus loves parties, virus loves human beings, virus loves crowds. At the system level, optimum testing, contact tracing, isolation of patients, isolation of positive cases, containment zones so that we contained the virus in a locality, in a localized manner. Do not allow this virus to go to other parts of your city or the village. And then above all, to be ready, fully ready and over ready to look after patients when they become sick. And to be ready in that sense would mean that our facilities are ready, our ambulance systems are ready. We have enough intensive care units and we have enough care that can be provided. Human resources are available. But also we learned that there is a real place for home care in the first wave as well as in the second wave, that a large number of people can also be looked after at home. And then when we provide support to individuals in home care through telemedicine, through reassuring words of the doctors on telephone, it can also save lives. It assures people, and also it assures that families remain in touch with their family members who are positive, protect themselves, and also make sure that the care is provided.
Dr. Reddy, there is really no way to predict any of this, but what kind of impact are we looking at in the event of a possible third wave, both medically as well as economically?
I must admit that anything that we say about the third wave is calculation, speculation, but the underlying reality, it is that it is almost inevitable, but to a large degree, mitigatable. And this ability to mitigate not just the numbers, but the impact depends on a series of things. The number of people we have vaccinated, our ability to communicate the whole aspect and the importance of this COVID appropriate behavior, or the fact that the virus loves crowds, like Dr. Paul was saying. I think also we need to continue to look at the science behind the nature of the virus. Are there more genetic mutations? What are the variants? How do we have to be more careful about it? What do we do about individuals who had been vaccinated, but now their immunity is coming down once again? Do you need a booster shot? What type of shot? And has the immunity of those who have been infected already, has that come down? So all these factors are complex, but need to be continuously monitored. And a combination of this scenario is really what will prepare us for the third wave, in addition to, of course, the most important thing, which is medical readiness. The people, the infrastructure, the medicines, the oxygen, these are lessons we've learned, and they're lessons that we must translate into infrastructure and readiness on the ground so that not a single life is lost. There is so much to be done and so many people ready to do it. So, programs like these just enable a readiness, inspire people to come together, to stay more alert, and to keep our country and our people safe.
Thank you for all your views that you've just spoken of. I just want to add a bit to a discussion and some points that I questioned earlier on about hesitancy to accept the workability, the authenticity of the vaccine, etc. I had the privilege to be appointed through the United Nations to work on polio immunization in India. And that was a huge task because we faced all kinds of problems. People not wanting to believe that these 2 drops of the polio vaccine can help them. But, it took us almost 8 years. And today, very proudly, we can say that India is polio-free. But how can we clear up this misinformation and the hesitancy around the COVID vaccine?
So, Amitabh ji, I think your iconic presence in the polio campaign is very well documented in that you helped break the hesitancy. I think we need you once again and many others to spread this message.
To say that, yes.
That, that the vaccine is critical. We have to break the hesitancy, and everybody has an episodic story. My cousin took 2 doses and still got COVID. But I will say that even if people get COVID after taking 2 doses, the impact of the virus is much, much less. And in a study conducted in Apollo Hospital on our own employees or our Apollo family, we found that of the 95% of people who got COVID despite 2 vaccinations, we were thankfully had not a single person who either had died or either had to go to an ICU. So we need to spread the message that vaccine keeps you safe from the bad effects of the virus. And that is the single message. We cannot say that you will not get COVID after taking the vaccine, because that's where credibility goes down. We must be very factual. And factually, it can protect your life by taking a vaccine.
As Sangeeta ji was saying, the severity of it is a lot lesser.
Correct.
And that needs to be told. Okay, you may not again get it, or you may get it again, but it may not be as severe as it was, and you will be saved. And that's the other point that I was talking to NDTV earlier on, is that one of the things, Prannoy, that we need to talk about is what is the mortality rate and percentage that is present in India today? And how does it compare with the rest of the world? And I can tell you that we are doing 1,000 times better than the rest of the world. And everyone thinks that we are the villains, we are the culprits. We are not. India is great, and we are able to do that. Don't compare us to the rest of the world, because the rest of the world does not compare with the mortality rate that India does. And that credit goes to our, that's thanks to our doctors, our frontline warriors, who are able to achieve this kind of work. That's what we need to say.
Yeah.
And I thank you on behalf of all the healthcare workers for acknowledging that, Amitabh ji, because everyone has worked so hard.
Dr. Paul as well as Dr. Reddy, thank you very much. I think it is very, the whole gist of what has been said right now is sahi jankari, sateek jankari. You want to end vaccine hesitancy, give the right information.
Right.
Don't tell people, just take it. It'll save your life. No, give the right information. I think that is very, very important. All right, joining us now, Aditi Hazra, Associate Epidemiologist at Brigham and Women's Hospital. For our viewers watching tonight's show, Dr. Hazra, can you explain to us what genome sequencing is? Because again, at the core of what is happening is information, and a lot of people get confused as to what really this is. And why is this very, very important with regard to the virus that causes COVID-19?
Thank you. Thank you for the opportunity. It's good to be with you. Genome sequencing allows us to look at all the 30,000 pairs of letters that make up the virus's sequence. As the virus spreads, it can mutate. Most mutations are not harmful, but some variant strains arise, and these variants can have a mutation in a critical region of the spike protein of the virus that can make it more transmissible, that can make it evade treatment and impact vaccines. But what we know is, as was just said by Dr. Reddy, the vaccine is effective. It is a shot of hope and a shot of science. We need the vaccines, and with the vaccines, the variants can be defeated. But what sequencing allows us to do is to track it, to say where is it spreading, how to identify new variants, and then we can control those specific areas. And we can also have clinical sampling to allow us to know how, if it's affecting a certain age group, people with a certain comorbidity, or certain symptoms are more severe. So that is the importance of genome sequencing, to better track, identify, and control the variants.
Aditi ji, this is Amitabh Bachchan. Thank you so much for joining us and giving us all the inputs. I have to admit that I'm not so knowledgeable or intelligent enough to know what genome sequencing is. And of course, that is something that I hope to learn after this program. But how can we tell this to a common man? Because we know that you believe also that this kind of genome sequencing or viral surveillance is something you're already looking into, and you want to scale it up in India through your volunteer group called India COVID SOS. How will this work? How will you be able to explain to people? How will you explain to the common man what this means?
Thank you, Amitji. It's such an honor, sir, to be with you. I would first say that the health of each of us depends on the health of all of us. And what genome sequencing is it tells us a story about the virus. The virus is made up of letters, and it has a spelling error that makes it more contagious. So we need to know, where is it more contagious? You have a grandchild. I have a niece. They are too young to be vaccinated at this time. So we need to protect them by understanding the variant, which one is spreading faster, and how we can control it. So that is why we need to do the genome sequencing, to track, identify new variants, to understand the behavior of the variant, and if it's affecting certain ages or certain populations more, and then we can control it. If it's in one part of the country, if it's in a rural part of the country, then we can implement or bring resources to that region. And what we know is that majority of the sequencing has been done in the cities. My goal is to help scale rural surveillance and to have more representative sampling throughout the country. It is just like getting a diagnostic test. Then that sample is sent for sequencing. So the diagnostic test tells you if the virus is there. The sequencing tells you the entire storybook of the virus. And one page is mutated or ripped out. So that is what we are trying to fix. Let's say we're running a race. You want to know which one is running faster. So that's what I would say. We are trying to catch the one that is running the fastest.
Thank you very much, Ms. Hazra, for that detailed information. Joining us now, Nobel laureate Kailash Satyarthi, as well as Dr. Amit Sen. He's a child and adolescent psychiatrist and director and co-founder of Children First. We're also glad to welcome back Lakshman Narasimhan, CEO of Reckitt. Kailashji, I want to first come to you. It's hard to understand where one can even begin to grasp what this pandemic has done to our children. बच्चों की मनोस्थिति किस तरीके से हुई है, प्रभावित हुई है इस महामारी के चलते, उसके बारे में अकल्पनीय है ये. Many kids have been orphaned by COVID, and this is a conversation that we have had in the past also. You began, talking about it first. You drew attention to this first. इस पर ध्यान कैसे दिया जाए, कैलाश जी?
जब ये पूरा मुद्दा ऑर्फन बच्चों का हमारे सामने आया और हमने उठाया और बाद में केंद्र और राज्य की सरकारों ने भी उसे लिया, तो हमारे पास ये मई की बात है, मई के शुरू की, एक किसी मोहल्ले से फोन आया कि एक आदमी का स्वर्गवास हो गया है, वो कोरोना पीड़ित थे और उनकी लाश पड़ी हुई है. उनके 3 मासूम बच्चे बिलख बिलख कर रो रहे हैं. कोई घर में जाने की हिम्मत नहीं कर रहा, ना कोई रिश्तेदार, ना कोई पड़ोसी, ना कोई दाह संस्कार करने वाला है, ना कोई बच्चों की खोज खबर लेने वाला है. पूरा दिन हो गया. रात को हमको ये खबर मिली. किसी तरह हमारे साथियों ने कुछ स्थानीय लोगों का इंतज़ाम किया और उनका क्रिमेशन हुआ. दूसरे दिन सुबह बच्चों के खाने पीने का इंतज़ाम किया गया, कुछ और चंदा इकट्ठा करके इंतज़ाम किया. लेकिन जो ट्रामा उन बच्चों को, जो सदमा उन बच्चों को मिला, पूरे दिन पिता की लाश के साथ रोते हुए, और कोई रिश्तेदार, कोई बाहर का आदमी उनके पास नहीं आ रहा था. ये जो ट्रामा है, जो बच्चों पर असर है, I have been saying right from the beginning that this is not only a health crisis. This is not only an economic crisis. This is the crisis of entire civilization. This is the crisis of childhood. This is the crisis of innocence. This is the crisis of future of the entire generation in the world. And we have to deal it with that sense of urgency for our children. हम लोग इस क्राइसिस से निकल जाएंगे, लेकिन क्या हम उन बच्चों को पीछे छोड़कर आगे बढ़ना चाहते हैं? क्या ये इंसानियत होगी? क्या ये सभ्यता होगी कि हमारे बच्चे पीछे छूट जाएं? And as we know that dozens of millions of children in the world would not be going to come back to their classrooms. Dozens of millions of children would be pushed into child labor, slavery, trafficking, child prostitution. Some of them could be picked up by some extremist forces or some terrorist forces using their or exploiting the vulnerability of such children. ये हालत हमारे दुनिया के बच्चों की है. And this pandemic has exposed and exacerbated the injustices and inequalities which were prevailing in our society. It has also exposed that how apathetic we are, how indifferent we are for our children. Not only in India, I'm talking globally. I work across 140, 150 countries for many, many years. And I know I have been in contact with my partners all across the world. And this is the situation of our children.
Dr. Amit Sen, this is Amitabh Bachchan. I just want to just take up a little further on what we heard just now from Kailashji. I had the great privilege to spend time with him on one of my shows earlier on some years ago, where he briefed us and told us and educated us on what was going through and what was happening to the children, and how he himself and his entire team had to struggle, sometimes in very difficult circumstances, to meet up these children, to save them. And the point that he has brought up today is, I think, extremely important, very valid. The children are going through some kind of a psychological trauma as well, along with the trauma of the disease. How do you as a doctor feel about the psychological impact that this is happening and the mental health of our children?
So thank you, Mr. Bachchan, for putting the question so well. And I'm inspired indeed by Kailashji's experiences and the way he's encapsulated the whole pandemic and the impact on children. And I completely resonate with this idea that this pandemic is a global disaster. And unlike other global disasters, like we've had massive disasters like the tsunami and the Gujarat earthquake, this is not a one-time thing, because those disasters often come and create havoc and death and destruction, and then leave us to at least pick up the pieces and rebuild our lives. But this is just ongoing, and it never seems to end. Every time we try to raise our heads, it knocks us down. So indeed, the experience of everybody, particularly of children, adolescents, teenagers, has been traumatic, deeply traumatic, particularly those who are in the forefront of facing it, whether it is through death and devastation in the family, or complete loss of livelihood, and so on. So it is imperative that we try and look at it from different lenses. So there are two things that I would like to highlight, and the knowledge or the ideas that I'm bringing here is really a collective knowledge that we've gathered in the last 1.5 years in working with families, with children, with schools and colleges, with NGOs and some government agencies. And what we have figured is that it is not just the fear, anxiety, and the devastation that the virus has caused in our lives, but it is also the lockdown, which has had an equally severe impact on children's mental health and development. So the first bit, of course, particularly in the second wave, when many young people have encountered death in such tragic circumstances of parents, of people they loved, they have, of course, got impacted deeply, and there is deep-seated anxiety, trauma. However, that's not the end of it. When this passes and when the dust settles, then the symptoms of depression, anxiety, substance misuse, self-harm behaviors, all those things start surfacing. And we have seen that rampantly. Very tragically, we have lost some young people to suicide in the last few in the last few months, and these are kids we have known over a period of time, families we've worked with, NGOs that we've worked with. This might have a deep-seated impact which may begin to unfold over months, years, and generations. We have seen that in the big wars and the famines, and perhaps in a partition, that when people encounter death, destruction, and such helplessness, then the aftermath of that can be very, very prolonged indeed. And we have to be mindful of that. The second part, of course, is the lockdown itself, which has caused children from, staying at home, not having any avenues or connections with the outside world. And school, which is a vital, part of their growth and development. I mean, how do children grow up? The little kids will go up, go out to the parks, they will go to their play school, they will interact with other kids, they will learn how to play, learn language and social skills. For the last 1.5 years, none of these kids have had that. The slightly older kids are the ones who are probably, looking forward to going back to their football coaching or the guitar class, the new friends that made. And yet the older ones, the adolescents and the teenagers, they are missing out on the rites of passages, going from one phase to the other. Like so many, millions of children who completed school in the last couple of years have not been able to go to college. And that's devastating for them because that's something, it's a milestone. It's a part of their lives which makes their identity, forms their personality. I wonder sometimes as to what kind of courage or what kind of bandwidth or emotional safety they might be able to feel to take, the challenges in the coming world.
ये जो पहली लहर चली ये कोविड की, उसमें जो कुछ भी हुआ, फिर एक दूसरी लहर चली और अब ऐसी संभावना है कि एक तीसरी लहर जो है, एक थर्ड वेव जो है, वो भी चलने वाली है। आपको क्या लगता है कि हमारे जितने भी बच्चे हैं और जिनके बारे में आपने अभी हमको उनका वर्णन दिया, तो बड़ा ही दयनीय था। और ये जो अब बच्चे आने वाले हैं, या अगर ये तीसरी लहर भी अगर दुर्भाग्यवश आ जाती है, तो हमारे जो बच्चे हैं उनको कैसे अवगत कराया जाएगा कि ये क्या है, उनके बचाव के लिए क्या करना होगा, कैसे उनको संभाल के रखें, उनको शिक्षा दें कि क्या है? क्या सोचा है आपने इसके बारे में कैलाश जी?
सब लोग कह रहे हैं कि इस लहर का सबसे ज्यादा असर बच्चों पर पड़ने वाला है। मैं एक ही बात कहना चाहता हूं कि हम पहले से इस बात की तैयारी रखें कि अगर बच्चों को नुकसान पहुंचाने वाली ये लहर आती है तो हम उससे बचाव कैसे करेंगे, सरकारी स्तर पर भी, सामाजिक स्तर पर भी। मैंने कई बार कहा है और आदरणीय प्रधानमंत्री जी को पत्र लिखकर कुछ सुझाव दिए थे, जिसमें हमने कहा कि ये जितने भी चाइल्ड केयर होम्स हैं पूरे देश में, सरकार के और गैर सरकारी इंस्टीट्यूशंस, CCIs जिन्हें कहते हैं, जहां 10, 20, 50, 100, 200, 500 बच्चे रहते हैं, उनमें सबसे पहले ये सुविधाएं और साधन मुहैया कराए जाएं। ऑक्सीजन के सिलेंडर्स और ऑक्सीजन के जो इक्विपमेंट्स हैं उनसे लगा के दवाइयाँ और बाकी चीज़ें, वहाँ के कर्मचारियों को, कार्यकर्ताओं को इस बात के लिए प्रशिक्षित किया जाए कि अगर एक भी बच्चे पर असर होता है तो बाकी बच्चों को कैसे बचाया जाए। कम से कम एक अस्पताल हर जिले में इस तरह के बच्चों के लिए रखा जाए। अगर अभी से लहर का असर होता है तो वहाँ वो सुविधाएं हों, वो डॉक्टर्स, नर्सेज इस बात के लिए तैयारी रखें, खासकर जो बच्चों के चिकित्सक हैं उनकी तैयारी होनी चाहिए। और अगर तीसरी लहर नहीं भी आती तो भी अगर हर जिले में एक बच्चों के लिए अस्पताल डेडिकेटेड हो पूरी तरीके से, तो बच्चों की बीमारियों का इलाज उसमें संभव हो सकता है। एक और बात मैंने प्रधानमंत्री जी से निवेदन किया और देश के प्रत्येक सांसद को अलग से चिट्ठियां लिखी, अलग अलग चिट्ठियां लिखी और कहा कि इस समय जो हालत हुई है ऑक्सीजन की, हॉस्पिटल बेड्स की, दवाइयों की, हर तरह की जो मारामारी पिछले 2 महीनों में हमने देखने को मिली, अप्रैल मई के महीने में, उससे हमें समझ में आता है कि स्वास्थ्य के मामले में एक बहुत ही बोल्ड और एक बहुत ही बुनियादी सुधार की जरूरत है। और इसके लिए सबसे अच्छा मौका अभी है कि हम स्वास्थ्य को मौलिक अधिकार का दर्जा दें। हमारे संविधान में कई जगह देखने को मिला है कि युवाओं में, नौजवानों में, बच्चों में, स्टूडेंट्स में उन्होंने सोशल मीडिया का जबरदस्त इस्तेमाल किया है। उनके अंदर का जो करुणा का सागर है बाहर निकल के आया है। एक दूसरे की मदद के लिए, खासकर जो बच्चे इधर उधर की चीजें सोशल मीडिया पे करते थे, वो प्लाज्मा ढूंढ रहे थे, वो ऑक्सीजन ढूंढ रहे थे, वो बेड ढूंढ रहे थे। ये हमारे देश की ताकत है और युवाओं के भरोसे पर हम लोगों को बड़ा कार्यक्रम बनाना चाहिए। स्कूलों की बात भी है कि अब स्कूल जब खुलते हैं तो स्कूलों को व्यवस्थित तरीके से खोलने का एक रोड मैप बनाया जाए। एक सरकार को, राज्य सरकारों को भी और केंद्र सरकारों को भी रोड मैप बना चाहिए कि स्मूथ और चाइल्ड फ्रेंडली तरीका हो उसका।
The attention that Kailash is drawing is extremely important.
Very
and
important.
it's very important, and it needs to be addressed on an almost like a war footing, because we're going to lose our next generation if we don't do that.
So Lakshman, thanks again for coming and doing so much for this campaign. We've seen what can happen when you're caught unawares, but you think you've got victory, and then another wave happens, then another wave, and it seems to get worse and worse. Now, what is Reckitt and Dettol doing to prepare itself and all of us and the communities it works for with this possibility of a third wave coming? What are you planning right now?
As we have looked at the situation, and we've learned a lot over the last 18 months, and we think about how we get ready for it, we really sort of broken it down into three parts. And I think the model we're using for ourselves also applies in some ways to the various communities that we are engaged in. The first one is really to prevent or slow things down. And that comes through the behaviors for us, ensuring our brands communicate the right behaviors so people learn in a simple manner. The other thing is ensure product is available, but also that we partner with a variety of organizations, be it schools, be it local communities, to ensure people understand what the behaviors are that are needed in order to slow things down while we get what's done right with regard to vaccines, what's done with regard to some of the antivirals that are being developed. And schools are a real place of focus for us in terms of how we navigate that. The second element of this is, even though we may prepare and we will slow things down, sometimes there's an unexpected variant that could come and you've got to in some ways respond. And there we've got to move at speed. Now, last time when all these things have happened, we've sort of used just the sheer energy of people, the entrepreneurship of people. But at this point in time, we've learned a lot. We've learned to be much more organized about it. And we focused on our supply chains to ensure they're agile, they're quick, and the investments have been made so we can respond quickly. Furthermore, because we've learned things about how to respond, the playbooks that we have built are being shared around the world. So that's the second area, which is how you respond and respond quickly. And the final thing is, one of our core values as a company is joining forces to win bigger. And what we mean by that is we have got to ensure that we've got the fabric, the partners, the communities, other companies all together to strengthen, the core fabric that we have, because the response cannot be done by one company or by one institution. We all have to come together. We all have to be united. So it's about preventing and slowing it down. It's about responding very quickly when things go wrong. And third is just ensuring that we're building connectivity through information. I think I love the push on, clean up the information, provide it to people so they know what really matters versus what doesn't. And you can't do it alone. You have to partner with various organizations, including with people like you at NDTV, to ensure that people understand what needs to happen. That's how we are preparing for any eventuality.